Moving on, the country recorded 544 new infections from COVID-19 on Monday, raising the country's caseload to 22,597 from 2,653 samples tested in the last 24 hours. Health Chief Administrative Secretary Dr. Rahid Aman, speaking during the daily coronavirus press briefings at Afya House, said the 544 included 499 Kenyans and 45 foreigners, composed of 315 males and 229 females aged between 1 year and 84 years. Pretty Musel, that report.
Kenya's COVID-19 infections on Monday rose to 22,597 after 544 more patients tested positive for the disease from 2,653 samples tested in the last 24 hours.
From the 544 cases we are reporting today, 499 are Kenyans, while 45 are foreigners. 315 are male, 229 are female. The youngest case is a 1-year-old infant. The oldest is an 84-year-old.
Nairobi recorded the highest number of infections with 412 cases, Kiambu 27, Machakos and Kajiado counties 17 cases each, Garissa 16, Uasin Gishu 14, Mombasa 9 cases, Nakuru 8 cases, Nyeri and Narok 5 cases each. Makueni recorded 3 cases, Laikipia 2 cases, Murang'a, Kilifi, Busia, Embu, Bungoma, Kisii, Kwale and Meru 1 case each.
263 patients have recovered from the disease. From this number, 176 are from the home-based care program, while 87 have been discharged from various hospitals, bringing the total number of recoveries to 8,740.
A nurse in Homa Bay County who succumbed to the disease shortly after giving birth was among 13 people who died from the disease, raising the total number of fatalities from COVID-19 to 382.
Marian Awor Adumbo, a 32-year-old registered nurse, used to render her selfless service at Rachuonyo Sub-County Hospital. She passed on at the Kisii Teaching and Referral Hospital yesterday evening. She has left behind her less than a week-old infant that she delivered at the hospital. Her death brings to 8 the number of healthcare workers that we have so far lost to the disease in the country.
Sadly, in a span of 5 months, we have lost 3 nurses who dedicated their lives to fight the COVID-19 for the sake of our country.
Health Chief Administrative Secretary Dr. Rahid Aman also revealed that the number of coronavirus cases will continue to rise owing to the cold season.
Seasonal variations, including extreme temperatures of both hot and cold, have been associated with increased morbidity and mortality among people with respiratory conditions such as chronic obstructive pulmonary disease or COPD. Cold seasons like winter can impact lung infections, lung functions, and even worsen the risk of infections.
The country has so far tested a cumulative sample size of 318,376. Purity Museo, Channel 1 News.